John Coster of Citizens Eye, and we're here still at the Tigers for the Choice Unlimited event, and we've come downstairs to the ground floor to catch up with Craig Mortimer from the Ashleigh Clinic. How are you, Craig?
Fine, thank you very much.
Good. Well, thanks for agreeing to talk to us. Tell us a little bit about today and how you found being here at the Choice Unlimited event.
I think for us personally as a clinic, it's been a fabulous day. I mean, we've spoke to a lot of people with certainly a very diverse array of injuries and various problems, with the most common one certainly being low back pain.
Okay, so tell us a little bit about the Ashleigh Clinic and why you started it.
The Ashleigh Clinic I started 27 years ago, having left the army as a physiotherapist, and I set up a clinic that essentially was related then to sports injuries. Having worked in professional football, and then I was working at the rugby club, and then I worked at Leicestershire Cricket Club. Now we've developed even further, and we're looking to develop our plans even more by building a rehabilitation centre where we can literally not only treat the patient but take them through phases of rehabilitation back to hopefully normal function.
Do you think with a lot of the injuries that we have at the moment, you get help for the injury, but then we don't actually look at the whole situation as to maybe why the injury occurred and then stop it from coming back?
Yeah, I do. I think that our medicine these days, and it's just the way the system is very symptomatic, and there's nothing wrong with being symptomatic to a certain extent, but I do think that you have to look anatomically why people, certainly at a musculoskeletal level, are getting these issues. And I think our job is to look at those issues, to try and target those issues so that we can improve mechanics and get patients to understand their injuries and be responsible for their own injuries. And then you take them through these phases of rehabilitation, and they can understand why they need to do things and what we're trying to achieve with them. Because it's an equation. It's not just all about the treatment, it is about what a patient does as well.
And what have people been speaking to you about today here at the event?
I would say essentially 90% of our people are low back pain, and I find low back pain very interesting, and personally I think that it's probably a lot of treatment that we do is very symptomatic and not problematic types of treatment, and I think we need to look at it a little bit more holistically with the way that we approach how we treat them.
Okay, well thanks for talking to us. Do you have a website that people could look at?
We do. It's www.ashleigh.co.uk, and Ashleigh is spelled Ashleigh.
Thanks very much.
Thank you.